Hello, my name is Marissa Johnson, and I am presenting interproximal dental care for my community dental services presentation. My objectives here are to eliminate the perceived need of education on interproximal hygiene, have my audience understand what interproximal hygiene is, how it can be performed, and when it should be done, and to make sure that the audience clearly knows how often a person should be getting their teeth cleaned professionally. I always like to include this. I feel like this is very important knowledge for everyone to have. So what is interproximal dental care? Well, dental care that is performed in between your teeth. We commonly know this as flossing. Flossing, however, isn't the only way that this can be accomplished. However, it is the tried and true way that we typically end up doing this, and we'll go more into depth on that a little bit later. But other ways that you can handle cleaning in between your teeth would be water flossing, a single tuft toothbrush that just has a couple of tufts on it, an interdental brush, which is kind of like the rainbow ones that are over to the right there. However, if there is a metal piece that is in the middle there and you have an implant, please steer clear of these. You do not want to use those on an implant. That would be very bad and damaging to the implant. You can also use a toothpick. However, you would want to use a toothpick if you have bigger spaces in between your teeth. If it's, not filled in by your gums, your spaces in between your teeth are filled in by your gums, you don't really want to shove a toothpick in there all the time to try and clean in between your teeth. It's not the most efficient way, but it is better than doing absolutely nothing in some circumstances, especially if you have food stuck. Floss picks, I have an image of that coming up in a little bit here. And then tufted floss. So floss that's a little bit thicker. Maybe you have a bridge or you're going through ortho and you have to get in between those spaces as well. Sometimes it's nice to have that for those bigger spaces. What interproximal brushing is not is just brushing your teeth with a toothbrush. It's not sufficient enough for you to be able to get in between the spaces of your teeth. It doesn't reach that far. So therefore, that's why we have to go in with some other kind of device. Swishing with mouth rinse also, while it is good to rinse, it isn't necessarily something that would be considered, something good for your interproximal to be able to remove all the debris and all the plaque in between your teeth. Or you could do nothing. Doing nothing, obviously not suggesting that at all, but that is definitely not what interproximal brushing is. So why is interproximal care important? Well, like I said previously, regular brushing doesn't clean in between your teeth. And there's a couple of analogies I have listed here that are really good ones that I tell my patients often to, kind of give you a better idea as far as why flossing and getting in between your teeth is so important. Because it's like brushing and flossing are like a combo meal. You can't just eat the burger without the fries. Or getting in the shower and not washing your armpits. What's the point? Or, when you go to wash your hands and you don't, wash in between the fingers, that's, ew. But, of course, my personal favorite that I don't necessarily say to everybody, but I would reserve more so for friends and family, it is a little crass, but it's very effective, which would be, not flossing your teeth is like going to the bathroom and just wiping your cheeks and not getting into the crack, to say that lightly. So when should interproximal dental cleaning be done? Well, it should be done at least one time a day. And on every slide, I'm basically saying brushing does not sufficiently clean in between your teeth. And it should be performed before you brush instead of after. I suggest you do it before bed. That way all the debris from the day, from all of the eating and everything is out. And it's not just sitting there in between your teeth while you're sleeping. It's important for you to brush also in the morning, though. You don't necessarily have to floss in the morning because there hasn't really been anything that has been put in between your teeth or pressed in between your teeth while you were sleeping. And we're trying to, especially at night, keep your mouth clean because it can be a breeding ground for bacteria, because in your mouth it's going to be dark, it's going to be moist, it's going to be warm. And say you only brushed in the morning and you went out, you ate, you drank, you smoked, you whatever, and you left that on your teeth overnight. I mean, I can't even imagine what is going to be on your teeth by the morning. Where can interproximal care be performed? Anywhere, but really you kind of want to do it in the bathroom so you can wash your hands. You're putting your hands in your mouth, and we've been so much more aware of how often we are touching our face and our mouths post-COVID, so keep that in mind. This part here, I really like this graphic. I wanted to go a little bit more into depth on how to properly floss your teeth. And it's funny because this one, it was a better image, but it ended up saying 50 centimeters of floss. You want about 18 inches, so like 1.5 feet of floss. And you want to wind them evenly around both your middle fingers. And then you want to have about 1 to 2 inches held pretty taut in between your thumb and your index fingers, and start feeding it in between your teeth. Now, you don't want to snap in between your teeth. You want to be able to, gently kind of go in, and then you want to feed the floss up into C shapes on both sides, touching both of the teeth. So you'll take it up one side, kind of slide it up under the gums, making sure that you're sliding gently, and then you would slide up onto the other side, and then you would pull out, you would change, you would uncoil some of the floss from one side, coil it up on the other, and continue the process around your teeth. And then, of course, this is something that I always remind all of my patients as well. I didn't learn this until later on in life. I wish I would have known sooner, but it is very important also to floss the back surfaces of your last molar. So that spot that's in between like the gums and where the tooth is, you still need to floss there too. It's very important. So more examples of interproximal care. This is what I was talking about. The one in the center is the your typical floss picks that you see at the store. If you have trouble, getting back there, that's always a great alternative. Water picks are always great. I don't always want somebody to use a water pick all the time. I want them to be able to kind of use it more so as a supplement to their flossing routine. But at the same time, too, any dental aid that is being used and used the correct way is better than not using one at all. And then, of course, super floss, like I said, you could be going through ortho, and it's easier because it has a stiff end to go in between those places. Or if you have a bridge, it's easier to get in between there, or even tight contacts. Sometimes some of us just have really tight contacts, and it makes us not want to be able to, it makes it difficult for us to floss. And so therefore we end up kind of snapping the floss in between our teeth anyway. It's very painful. It's not good for the gums. So therefore being able to kind of slide this between those wide spaces is very, very helpful. Last but not least, I wanted to cover routine cleanings. So routine cleanings are incredibly important. The best rule to remember, if you remember anything, is the 2-2-2 rule. This is for basic standard patients that are needing to just go to the dentist 2 times a year. Some patients who end up with some kind of gingivitis or periodontal disease, such as periodontitis, will end up needing to go back maybe, 4 times a year, 3 times a year. It just kind of depends. But you need to discuss that with your dental care team at your dental office. But the 2-2-2 rule would be you brush 2 times daily for 2 minutes and have your teeth cleaned professionally 2 times a year. And that's why I wrote at a minimum. Here are my references for some of the graphics that I pulled today for some of the products that I found. If you're wanting more information, and if you have any questions, please feel free to send me a comment or to send me a message, and I will get back to you. Thank you so much for your time.